Okay, so welcome. My name is Sharon Chamberlain, and I have the very, very fortunate job of being the CEO of Northern Nevada Hopes. I'm so happy you chose to join us today, and I want to welcome you, whether you are skipping school or skipping work, or you just came from one of those little mini bundt cakes out there. We're happy that you're here. And I say that because I happen to have some very, very special guests, including a surprise guest, who's just my brother. And my hands are sweating because he's here. But he's back there all the way from Ohio. I love you, Russell. I also have my wonderful wife and my two children here. And I was saying about this weekend, I overheard them. I overheard the kids chatting, and they were talking about coming to the grand opening, and I just had this overwhelming feeling of warmness, and I said, God, you guys, you're so awesome. I love you. I can't believe what incredible kids you're growing up to be. You want to connect with folks that are different than you. You want to be there to support, and my oldest turned and gave me that preteen glare, said, duh, I get to miss school. So there she is. You're welcome, Maya. Well, today marks a very important day. We began offering services out of this building on February 1st. It took a year to build this place. It feels sometimes like it took so much longer, and sometimes I can't believe that it happened as quickly as it did. During that time, the clinic continued to see patients. We average about 200 new patients every single month, and that continues today. We operated out of a small, modular building. I called it the toilet bowl because it sucked, honestly. It does. But we persevered, and on the day the new doors opened, I had first day jitters. I didn't think that was going to happen. And I was downstairs to greet all the staff as they came in with Kim, one of our administrators. There, Kim, right there. We had to hand out badges and codes to everybody. It was a complicated and nerve-wracking process, and trying to get everybody not to set off alarms on the first day. It was difficult. But I was just moved and overwhelmed once again by the diversity and passion of our staff that show up here to work every single day. We serve a bunch of characters here, but quite honestly, our staff is a bunch of characters also. Each of us came here through different means, but we are all a perfect fit. Some of us were homeless, some of us struggled with addiction, some of us struggled with mental well-being and still do. We were sex workers, drug addicts, but we are also brothers and sisters, children and parents. And today, as a staff, we are passionate about acceptance. We are passionate about removing barriers to accessing care. We are educated, and we are powerful because of our histories and our stories. I don't know if this staff person is in the room right now. I'm hoping not. I'm going to share a little story and ask forgiveness later. Because some of us that came to Hopes did not know that Hopes was the place for us. And a few of us even fought that love a little bit at first. Anyway, one of our staff members came here as a favor to another doctor that worked here, Dr. Krasner. And the doctor had reached out to her. She's an MD too, and said we needed some help as we grew our primary care practice. So she said yes to Dr. Krasner. And on her first day, she rolled up in her fancy sports car and thought, what the heck am I doing here? And I was watching out the window, not because I'm creepy, but because I like to watch the first-timers when they come to our property. And I'm pretty sure she actually got back into her car and drove to Starbucks to park because she didn't feel safe in our parking lot. Anyway, I was watching her, and I wanted to see what she was made of, and I began to notice that she slowly started showing up in baggier and baggier scrubs. And one day, Scout's on her, she showed up in a burlap sack. Almost. And so I asked one of the nurses, and she said all of the patients were hitting on the young doctor, so she was trying to dress it down. 17, that was the number of proposals she got that first week. So on the second week, she showed up with a fake wedding ring. I kept watching her and had a few conversations with her. Well, fast forward to now. Dr. Danko, that young doctor in a burlap sack, is now our chief medical officer. She still drives a fancy sports car, and she's still single, I think, for everybody out there. Dr. Danko now runs our MAT program, which works with young drug addicts involved in the court system. She describes those kids as amazing, strong, and resilient. As an internist, she often sees our most complex patients. She passionately advocates for them to gain access to specialty care throughout our community. She calls in favors and pulls strings. As our CMO, she is often called on when a patient is in crisis, and every single time, she addresses that patient with compassion and humility. We needed Dr. Danko. Hopes needed her, but I don't think she knew she needed Hopes. But that is what Hopes does every day, in every way, whether you are a client, staff, or volunteer. Dr. Brene Brown said, "There is no greater threat to the critics, cynics, and fear-mongers than those of us who are willing to fall because we have learned how to rise." We envision a better you, a more effective you. We welcome you into our community with open minds and open hearts. We ask your story and we shout it. We are not embarrassed of our past. We are not embarrassed of our growth. We are non-apologetic as a community. We welcome everyone. I saw this billboard advertising an elite school, and it featured an elegant-looking young woman, and in bold lettering it declared, "If you're exceptional, you'll fit right in." Well, here at Hopes, we boldly declare that the forgotten, the ignored, the rejected, the invisible, no matter what your skin color or your income level or your gender, we say whether you are upper class, middle class, lower class, or if society says you have no class whatsoever, you are a human being, and that makes you exceptional. And here at Hopes, you will fit right in. So welcome today. Thank you for being here as we celebrate the opening of the Stacie Mathewson Community Wellness Center, providing fully integrated medical, behavioral health, and wellness services regardless of your ability to pay, all under one roof. None of this would be possible without support from our community. One way that support comes is through volunteers. We have a client advisory board, the CAB. Look for them today with the blue shirts. They have t-shirts and name tags on. I meet with this group monthly. They share feedback they get from patients. Sometimes it isn't delivered particularly nicely. One of their things they like to tease me about is how many times they've brought me to tears for being so hard on me. I deny that's ever actually happened. The men and women of the CAB are truly amazing, so please thank them when you see them. We also have a board of directors. Right now we have 12 members. I work for a lot of boards and have never worked for such a talented and passionate group as my board today. Could you please stand for recognition of your tireless commitments to Hopes? Now I would like to introduce you to a man, a mentor. I have a lot of respect for, Mr. Doug Brewer, our board president.
Wow. This is, I was assuming there would be a few people here, but we've kind of gone way beyond a few. And so first, I would like to say a couple things about, Sharon mentioned about the staff and the people that are here that make this place what it is. And I would also like to especially acknowledge that a few years ago, we brought on a new CEO to Hope's. In my tenure here, we've been through, well, let's say we've been through a few that have been a little less than successful. And then we found Sharon, or Sharon found us, or we found each other. And I would like to acknowledge the fact that Sharon has been the leader that Hope's has needed. And she has brought this organization from operating out of a worn-out motel to our building today. As Sharon mentioned, I'm Doug Brewer, and I've had the honor of serving as board president for Northern Nevada Hope's for the last 3 years. Today marks a major milestone in Hope's history. Almost 20 years ago, Hope's opened as the region's only HIV clinic. When people living with HIV in Northern Nevada had nowhere else to go, Hope's took them in and provided judgment-free, world-class care. But Hope's didn't just treat patients' HIV. Hope's provided compassionate medical care plus essential services like housing and transportation assistance, medication adherence counseling, therapy, support groups, and nutrition assistance. This individualized care broke down barriers for patients who struggle with poverty, addiction, unstable housing, stigma, and the inability to pay for critical HIV medication. Thanks to Hope's, more than 600 Nevadans living with HIV had a place to call home. Today, Hope's has taken that same model of patient-centered care and brought it to the Northern Nevada community with the opening of this building, the Stacie Mathewson Community Wellness Center. Thank you, Stacie. This brand new facility brings comprehensive and personalized health care to Northern Nevada and also helps to revitalize downtown Reno. Our wellness center will now help us provide our more than 5,000 existing patients with access to high-quality medical and wellness services at Hope's, regardless of their income level or ability to pay. This number is expected to double to 10,000 patients by next year. This new facility will allow us to continue to expand services and to improve access to care. Hope's now also provides pediatric primary care, pediatric psychiatry, on-site radiology and diagnostics, and expanded substance abuse treatment. We will begin providing immediate care and more complementary medicine later this year. Our expansion has also created more local jobs. In the past 3 years, Hope's has hired an additional 75 staff members and now has a growing team of 100 employees. In Northern Nevada, people face high rates of chronic disease, poverty, homelessness, and addiction. Hope's is committed to solving these issues with medical treatment, community outreach, housing and transportation assistance, behavioral health counseling, and substance abuse treatment. Our integrated care model eliminates barriers and treats the whole patient, not just the illness. I want to thank you for your support of Hope's and your commitment to our community's underserved populations. Together, we are building a healthier and stronger Northern Nevada community. Thank you very much.
So, this is a $13.1 million building, and you ask, how did we do that? I'm so glad you asked. We are still doing it, so keep with us. We're still in the middle of our capital campaign. We've raised over $3 million to date with the capital campaign, and when we complete that campaign by raising $2.4 million more, we'll move into this building debt-free. The other dollars came from a program called the New Markets Tax Credit Program. We met certain criteria for participation in the program, including being a designated health provider shortage area. The program structure is complex, extremely, but we managed to pull that deal together. I want to thank U.S. Bank and all the community development entities, including Stonehenge, Affirmative Investments, Enhanced Capital, Clearinghouse, CDFI. Also, the Nevada Department of Business and Industry, in particular, Bruce Breslow. The NNTC program funded over $7 million of the building. Thank you. Of course, none of this would be possible without the support of you, the community. I encourage you to look at our boards out in the Galleria to see the names of hundreds of people that have made this possible today. I would like to recognize now our visionary donors with gifts of $10,000 or above. Stacie Mathewson, Nell J. Redfield Foundation, Renown Health, William N. Pennington Foundation, Robert Z. Hawkins Foundation, physicians Dr. Rika Danko, Dr. Dalrymple. He also gave us all the artwork out front, all through the agency, so please look at that beautiful photographer. Dr. Tu Young and Dr. Bahin Ayin, the E.L. Court Foundation, the Revilio family, Moana Nursery, Bank of America, NV Energy, and the Roxy and Azad Joseph Foundation. Thank you. I would like to invite an amazing woman to say a few words. I was at one of her events a couple of weeks ago. She is articulate and well-spoken. She has a vision for our community that is clear. We are so fortunate to have connected with this amazing woman and look forward to our future work together. She gifted Hope's $1.9 million for this building. She believed in our vision, and I cried when you gave us the check.
Tease Sharon that it's hard to follow her because she's always so. She says she never gets nervous, and I say I never get nervous.
Blame it on the new building.
The battery maybe. In there.
So anyway, I just want to say that it is an honor to be a part of Northern Nevada Hopes. So, yes, Northern Nevada Hopes is offering Reno, Nevada such a great opportunity to have free medical for anybody who walks in off the street. It does not matter whether you are from Reno or from Mars. I mean, you walk in off the street and you have medical treatment. How great is that in our town? And look at this facility. This facility makes you feel good when you walk in. It's well equipped. It means we care about you, and it has the ability to expand, and it's downtown Reno, Nevada, and that's something to give behind. My husband is Chuck Mathewson, is very philanthropic, as well as I'd like to follow in his footsteps. There's a bear! It's so busy, you guys, I couldn't get in here. Isn't that great? I know. Yeah, I know, this is great. And so, to be able to come in and support an organization like this, what an honor. And the fact that it does say Stacie Mathewson on the building does not mean that it's that anything more than I support this Northern Nevada Hopes. Northern Nevada Hopes has been able to get to the point where they have this. I mean, they started out in a floppy old motel and as an AIDS, clinic, and have grown into full-scale medical with a phenomenal. This lady is phenomenal. Not just Northern Nevada Hopes. But my passion really comes into play with addiction. I looked at Northern Nevada Hopes. We walked in, saw the potential, what they were doing for the community, and I went back to my husband, and he's just got this great ability to really, intuitive ability. And he looked at it and said, this is really going to be something. And so he stood behind it. And we asked Northern Nevada Hopes if they would add addiction treatment to their component, which they did. And that was very important for me, as my son did die of an overdose 3 years ago. And so my work is behind addiction and really focused on helping those who can't help themselves when they're in their addiction. And so now Northern Nevada Hopes is going to provide that treatment care in addition, and that is that just brings it to more of a well-rounded medical clinic, because I think the population that Northern Nevada Hopes really serves will have that component to that problem when they walk in the door. A lot of that population will have that problem. Although I went to a very well-known restaurant in town, and this waiter who had been working at this, it's a really nice upscale restaurant, and he came over and he said, I heard about Northern Nevada Hopes, and I live downtown, and I'm going to start treating there. That's going to be my medical provider. And I'm like, great! And then I started walking in thinking, I'm going to come here for my medical treatment. I love too that we did also ask to name the kids, the pediatric unit, after my son and his daughter. And so that was it's a nice honor, and it really feels good to be a part of this organization. My nonprofit, I just bought some property across the street, so I'm moving into the neighborhood. We hope to add a center for the community to help with case management as well as return to work development. But anyway, I just want to say it's an honor to be a part of Northern Nevada Hopes, and I look forward to being a part of it for many, many years to come. Thank you.
Thank you, Stacie. Oh, goodness sakes. Okay, I'm going to try it again. Thank you, Stacie. Sorry about the mic issue. We'll work on that. So, here in our wonderful city, we face our own set of challenges. We all know that health is so much more than just your blood pressure, managing your diabetes, or your hypertension. Sure, our health includes access to medical care, behavioral health care, and drug treatment services, access to affordable prescriptions, all things we provide at Hopes. But the true health of a person, of a community, includes access to affordable housing, access to food, access to transportation, and jobs that pay a living wage. As Reno grows, developments move into the area that are currently inhabited by community members who are struggling to make ends meet. And as people move to the city, we step up our efforts to address blight, homelessness, and access to services. I see this as a time of incredible opportunity. We're poised on the edge, and in that balance is great opportunity, a choice the ability for a city to do the right thing. Not only will we embrace growth, but we will lead the country by demonstrating and putting into practice our commitment to human lives, each and every person that calls this community their own. In time of great growth, you need great leaders. I've had the opportunity to work closely with some of the folks that run our fair city, and I've been impressed with their willingness to listen and take action. The other week I met with Councilmember Jordan. She was talking about the overflow shelter that had to close down earlier a couple of weeks ago, leaving over 100 people without a place to shelter at night. Before I left her office that day, I mentioned that Hopes would be happy to help out in any way we could. We had to just moved in and would be happy to host some guests overnight, just to keep people out of the weather and off the streets. Quite honestly, I figured she wouldn't follow up with me. She has a lot of competing priorities on her plate, right? So you can imagine my surprise on Saturday morning the next day when I got a text that said, "Hey, could you take some people from the overflow shelter?" And so for the last 2 weeks, 30 people experiencing homelessness have had a safe place, a dry place to lay down every single night right here at Hopes. That is a choice, that is action, that is compassion, that is commitment, that is a community in action, and that is leadership. Well, we are lucky because we have another great leader of this city who's with us today, and thank God you came. I was getting nervous. It's okay. And this morning, I have the honor of introducing a woman I admire a lot. She is a strong leader who shows compassion, tolerance, and happens to make me laugh. I have seen her push the difficult conversation, listen to those who so often don't have a voice, and remind us that a community is only a community when it is inclusive. Please help me welcome Madam Mayor Hillary Schieve.
See, how does this work? So it goes from Stacie to Hillary. But literally, it was so packed out there, I couldn't get through. I could not get through. This is amazing, truly. On behalf of the City of Reno, thank you everyone for being here today. This center is truly a blessing from God. I believe it. It's amazing. This center, I cannot tell you how fortunate we are to have something like this in the community and have partners that come together like Stacie Mathewson, like Sharon Chamberlain. I swear to God, you should get a Pulitzer Prize one day. You are the most amazing woman I have ever met. It's unbelievable. We are so lucky to have you in this community. We really are. And I'm fortunate to work with many of you guys on Operation Downtown. And I have a great council that supports me. I know Councilman Bosse, and where's Councilwoman Jordan? Where are you?
Over there.
Oh, right. Councilman Delgado, come on up here. I think it's really important because right now we are at a pivotal time in this city, and this city is really poised to make some big changes. But we can't. Is Councilwoman Breckus here? Councilwoman Breckus, I don't know where you are, but if you're here, come on up. Really important to have a commitment from our council to make sure that we continue to provide additional services and to help sustain programs like this. This is so important, more now than ever. But I was fortunate enough to, I have a very good friend who has HIV, and it was about 4 years ago that he was treated with Hopes, and it was the first time that I had ever heard of Hopes. And I have to tell you, they saved his life. And he will not go anywhere else because this is home to him because of the incredible care that he gets here. It is truly miraculous. But I also want to make sure, I know this big, beautiful building sits here and we're so fortunate to have it, but it can't stop here. We need your help and we need to continue to push this movement. We need to continue to push for people to donate. It could even be small things, whether it's your time or even $5. This is really, really important. So we cannot stop here. We have to continue to support hopes and continue to support Sharon and this mission and all the staff that works here. This staff is phenomenal. I cannot believe how incredibly dedicated and caring and compassionate this staff is. I have never seen anything like it. So again, we are so incredibly fortunate, but I need your help. Sharon needs your help. Hopes needs your help. This council needs your help. We have to continue to make sure that this thrives and grows in our community because we need this now more than ever. But the work you do here is truly life-changing for so many people. And the level of care is so high that you heard Stacie Mathewson even wants to be here. So I want to just thank everyone for being here today. It truly is, it's miraculous because here we were several months ago putting shovels in the ground, and you can't really picture it until you get there. And because of your generosity and all you've been doing in the community, dreams like this can really happen. And this will change people's lives on a daily basis. We were just here for a very short period of time having our Operation Downtown meeting, and just to see the people coming in the door and being, thank God you're here, thank God you're here. So I just have to say, this makes me, I think, the proudest mayor in the world. She has no idea how much that I respect her, and we want to make sure that we do everything in our community to help you because you are such a huge asset.
Can I say something? I like to say I lived here for 25 years and then been away, and then I see the improvement of downtown. I'm a sole supporter of the Reno downtown development, and I hope that Reno continues to develop downtown because we really need to change the downtown area. And I'm along with the boutique, or it's now called the basement. I like to see the downtown Reno improve as time goes on because we really need to improve Reno and get on the map. And we need to be in first place, not fourth, but first place.
So anyway, I'm going to get off the mic because everyone hates a politician that gets up here and stands way too long and talks. But thank you so much for allowing us to be a part of this, and thank you to my council members and to all of you guys. Please, again, my plea to you is do whatever you can, whether it's volunteering your time or $5, I don't care what it is. We've got to support this in our community because we need it now more than ever. And so thank you for stepping up and being who you are.
I don't want the mayor's fault.
Oh.
Thank you. And thank you for the council members that came today. We appreciate it a lot. I wanted to recognize all the community partners that Hopes works with, but decided not to read through a very long list. But I do want to share, which all of you probably already know, is that we have an incredible network of community-based organizations that provide a wide range of services, often unrecognized to people living throughout our community, and their work is invaluable. I just had a thought pop in my head, which is always dangerous. I have to say this is that, in the nonprofit world, we often hear all the time, I hear, I hope you're not duplicating services, Hopes. And I'm sorry, this popped into my head. And I have to say that, we don't say that about other businesses. When is the last time you said to Starbucks, what on earth? Starbucks 2 blocks away from the Starbucks. We're doing important services. There's so much need out there. We want to be connected and support each other. And I think that Hopes and other members in this community that run nonprofits do a remarkable job. We're so close with Community Health Alliance, who is the other FQHC. He couldn't be here today, Chuck, because he's over in DC doing some educating legislative folks. So we appreciate him too. So I have one more person to introduce today. I had invited Dr. Tony Slonim, the CEO at Renown, to speak. He is a remarkable speaker, and I was excited about that. But he's come down with a bad food poisoning, which never happens to him, and he isn't here. So in his place, I have someone as wonderful, and possibly more so. She is the treasurer of my board of directors. She is the VP of Governmental Relationships at Renown, and suffice it to say, one of the smartest women I have had the pleasure of working with. Renown has been a big community supporter of HOPES, donating to the Capital Campaign, working to find ways to prevent hospital admissions and manage patients to healthier outcomes. Please join me in welcoming Chris Bosse.
Well, good morning, everybody, and as you can see, I'm not Tony, but this morning when Sharon mentioned that Tony wasn't going to be able to make it, I was actually really excited. This is a great opportunity for me. I've been a board member for a number of years, along with the great group that stood up earlier, and really watched this organization evolve, especially under the leadership of Sharon with the great team that she's built. It's been an amazing journey to be on this board. She basically in the last few years, I would argue, has pulled us along. And it's been educating and exciting and great to be part of such a worthwhile venture. We actually, my organization has been involved along with the other hospitals in this community since HOPE's inception. We all got together back in the 90s, and we were part of starting this organization. And I can tell you, I've been in this community that long, hard to believe, but I've been in this community during that time, and I will tell you, I've not seen more change than I've seen in the last 3 years. Transition to FQHC, broadening the scope to be able to ensure that people can access care when they need it, and then this amazing facility project. The board many times had questions and issues and need to understand, and at the same time, Sharon and her great staff provided that information, and here we are today. It's truly amazing. We were fortunate enough this last year to be able to donate to the building campaign, and I encourage anybody in this room who's not done that already, please do that. It's a great opportunity to show our support as a community for this organization. And I guess the last thing I would add to the conversation today, because everybody in the room, everybody who's spoken previously has really talked about all the great services and what we've been able as a community to be able to accomplish to this point. I would say Renown Health really looks forward and is excited about the opportunities for new and innovative ways to partner in making sure that people have access to care, to improve their health, and that's all I have for today. But thank you so much for allowing me.
Thank you, Chris, very much. We are almost done here. We had, oh gosh, what's the word? What are those called?
Dignitary.
Proclamations. Sorry, proclamations. And we appreciate it very much. We had from Senator Harry Reid's office, Senator Heller's office, and Congressman Mark Ambe. So we appreciate you being here and their representatives being here today and providing us these proclamations. Thank you very much. So thank you all for attending. We got through the brief remarks. Sorry we went over. More importantly, thank you for being here and sharing in this vision for a healthier community. If you'd like a tour, please stay. We'll have tours.